Good evening students. Now we are going to see about planning. So already we have the class of assessment. So this is the continuation of assessment class. This is coming under nursing process. So you know already well about nursing process. There are assessment, nursing diagnosis, and in that planning, implementation, rational and evaluation. So in that one part is planning. So now we are going to, already we discussed clearly about the assessment, nursing diagnosis and goal and all. So now we are going to see about planning. So why we plan and how we plan. So why we have to plan? By assessing the needs and problems of the patient, we have to plan what I am going to do for my patient, what nursing care I am going to provide for my patient. So that is planning based on the problems, needs and the chief complaints. So first let us move to definition of planning. So what is the definition is? It is the process of deciding the nursing care or actions to be given to the patient for nursing diagnosis already formulated. Yes, so here itself they brought the word nursing diagnosis already formulated. Yes, because the first thing is we will do assessment. Second is we will do the make the nursing diagnosis, and third is we will set the goal, and fourth step only we will go to planning. So that only they have given the word for the nursing diagnosis already formulated. What we have formulated, now we are going to plan for the particular nursing diagnosis. It also serves as a document that communicates the patient's nursing care to all members of the healthcare team. So this is the type of a communication from one person to another person. Why? Because what you have planned, you are recording in the record, automatically that can be viewed by the another healthcare person, and there will be continuation of the nursing care. So that is why we are doing planning. So planning is very important step in the overall nursing process. Next we move on to what are the purpose of planning, why we have to plan. So first one is direct clinical care. So it will direct our clinical care. What is first, what is next. So that is called first one, direct clinical care. Then second one is develop an individualized care plan. So we can develop an individualized care plan for each individual. So for that we need planning. Then third one is guide for nursing action. Guide for nursing action means next what I should do as a nurse, what nursing care I have to provide for a patient. So if you have proper planning, then automatically it will give you way for you to concentrate on the next step. So that is called guide for nursing action. Then fourth one is provides direction for implementation and evaluation. Provide direction for implementation. So automatically implementation, evaluation is the next step of the planning. So it will give direction for us to implement and evaluate. The last one is organized. So generally planning means it is an organized thing. So last one is organized. So these are the purposes of planning. Then again continuation of the purpose. Nursing care plan identifies and coordinates. So it will coordinate one thing to the another thing. Then enhance continuity of care. So continuity in the sense we will not skip any type of nursing care in between. We will go step by step, priority wise and step by step we will go. Then written care plan helps in handing over shift. So this is when we are handing over the patient, that is from one shift to another shift. So automatically it will be useful for the another nurse to what the previous nurse have given, what type of nursing care she have given, and what should I implement. So it is a very good communication during the shift period. Then includes long-term needs of the patient. So it will ease us to provide long-term needs for the patient. It will make us to meet the long-term needs of the patients. The last one is care plan enhances continuity of care. So there won't be any breakdown in the care. It will be continuous from one step to the another step. So next is types of planning. What are the types of planning? So we have three types. One is initial planning, second is ongoing planning, and third one is discharge planning. So in initial planning means before you start your nursing care, you have to make a, just based on the symptoms, you have to make a initial plan. Then ongoing plan means during, in between the nursing care, if anything is needed in emergency, so that you have to concentrate, that is called ongoing planning. Then discharge planning is, the word gives the meaning. Discharge means during the discharge, what are the follow-up care we have to give for the patient, that is called discharge planning. Then again, standing orders and protocols. So this is also coming under planning. In planning, this is the important part. So what is meant by standing order and protocols mean? It is a written document with rules and policies and procedures, regulation orders for the conduct of patient care. So there should be some continuity in the patient care. So in each and every ward and in every hospital, the standing orders and protocols will be followed. Then these are medical guidelines for the medical treatment. So it will be useful for medical treatment also. Next we will move to planning process. So in planning process, first one is establishing priorities. Second one is establishing patients' goals. Then third one is selecting nursing strategies. Then last one is writing care plans. So this is about the planning process. Planning is very simple only, but when we come to nursing, when we come to practice, so it's a very big thing, but when it comes to the content, so it is very simple. So planning is a very important part in the nursing process.